it sounds crazy to think that, I was sick for 4 weeks and thought of killing myself. But by the end, you really do. You have all of this time to think to yourself and to wrestle with your demons, and all you do is suffer. And because you're depressed, your brain convinces you that you can't be fixed. It's like your own body turns on you and is your worst enemy. And I had this incredibly supportive partner who would come to me every day and say, you are going to make it. I know it doesn't feel like it, but you will. And I couldn't believe her. Like, I just couldn't. I thought, I'm glad for you that you believe that, because maybe it makes this easier to watch. But I think I'm going to die at the end of this.
Okay, life can be crazy. You're feeling like you're sinking, just trying to find a meaning. It's time for better thinking. Yeah, better thinking. Time to tune in. Let's go.
This episode, I interview Professor Travis Rieder, who's the Assistant Director of Education Initiatives, Director of the Masters of Bioethics degree program, and Research Scholar of the Berman Institute of Bioethics. He's also a faculty affiliate of the Centre of Public Health Advocacy within the Johns Hopkins School of Public Health. Today we talk about the use of opioids and the crisis in how it's being prescribed, and most importantly, how people are struggling with getting off opioids after a severe trauma. Professor Rieder speaks about his experience, his personal experience following a motor vehicle accident when he was on a motorbike and his foot was crushed. He calls it blown apart, where he was very lucky to have his foot still attached, where there was lots of consideration about amputating. But most importantly, his journey through the opioid experience, where he went through severe withdrawal. There's a really compassionate message that Professor Rieder talks about, and it really comes towards the end of this episode, so please listen through to the end. I think Travis has some amazing point of views to go out and explore, to do this better as a society. Enjoy. You're going to find this very fascinating, and hopefully one day it'll be able to go out and also help you and maybe some loved ones in using pain medication in a more effective way. Really happy today to have Travis Rieder on the podcast, Better Thinking. He's got a lot of experience, lived experience, and looked into the topic of the opioid crisis. And it's something that I'm fascinated by, because we certainly hear a lot about, illicit drug use and the problems that come, in that sort of space. But very often it's kind of forgotten about the prescriptive world and the many of us, the thousands, countless, hundreds of thousands who are using, opioids, whether it be through an injury or other chronic use for injury management or medical reasons. And so really, I think there's no one better to talk about this than Travis. And thank you and welcome to the show.
Thanks for having me. Appreciate it.
Travis, do you mind maybe telling us a little bit about, your history, your background? I know what captured me first was seeing you in the TED Talk discussing this in your personal story.
Yeah, sure. So prior to about 2015, I was doing very different things with my career. I'm a faculty member at Johns Hopkins University, and back then I was spending almost all of my time on climate change ethics. I thought a lot about overpopulation, very, very different sorts of stuff. And then what really changed my career and changed everything was I was in a motorcycle accident. So May 23rd, 2015, I went out for a motorcycle ride, and I only made it a few blocks from my house. A van came from a side street, blew a stop sign, and T-boned me on the motorcycle. So it crushed my left foot between the bumper of the van and the motorcycle. I know that's pretty gruesome. So I felt very smart. I was wearing like full racing leather and full face helmet and body armor. But it turns out it doesn't matter how much body armor you're wearing. If you get crushed between two hard surfaces, there's not a whole lot you can do to protect yourself. So my left foot was pretty severely damaged. I was in what's called a limb salvage situation. So the doctors assumed they were going to take at least part of my foot, if not the whole foot. And that's what really set off everything for me. It landed
As in
me in
to
the
amputate
hospital.
it, to take it off.
Yeah, as in
Wow.
amputated.
Wow.
Yeah. So I was taken to the nearest trauma center, and that was the beginning of a very long road to recovery for me. So I had 5 what are called limb salvage surgeries. So surgeries to try to salvage the limb. And then I would eventually have another surgery some 6 months later after the initial swelling had gone down and they could kind of reshape the foot. But those first 5 surgeries took about a month, and I was in 3 different hospitals while specialty teams worked on it and tried to pull it off. Yeah, so like the positive spin on this story is it's kind of a medical miracle. Like I still have my foot, and it's really complex what they did. They carved out a big piece of my thigh and plugged this hole that I had blown in my foot with muscle and fat, and they covered it up with skin, and they microsurgically attached an artery to get blood to that tissue and a vein so that I could feel, or a nerve so that I could feel things. I mean, they did something pretty amazing. But it started me down on this road of pretty heavy use of opioid painkillers. And so that's what kind of took me on a whole different trajectory.
Isn't it incredible that modern medicine can go out and do that? That's just mind-boggling. Mind-boggling.
Truly,
in some sense, kind of restructured your whole foot, you know, and did some, you know, what sounds to me is like science fiction.
Yeah, exactly. I mean, you know, the first 3 bones, the long bones that connect your ankle to your toes, you know, the first one was completely shattered and blew a hole out through the inside of my foot. The second and third ones broke clean. I mean, it was a really gnarly injury. And yeah, not too long ago at all, you know, some years or decades prior, they would have just looked at that and said, well, we're going to amputate your foot. And as a matter of fact, if I had been most places in the world, they would have just looked at that and said, we're going to amputate your foot. But I happened to be on the East Coast of the United States, near Washington, D.C. and Baltimore City. So I had, you know, world-class doctors kind of at my doorstep, and they pulled off something pretty impressive.
That's absolutely incredible. It's absolutely incredible to in some sense have a functioning foot. You walk on it as per normal. You know, I'm assuming still some pain, but you've got a foot.
Yeah, exactly. Still some pain. Probably more surgeries in the future. You know, I can't like run. I can't do a lot of things that people with 2 working feet can do. But I find stuff to do. I go rock climbing. Which I just use the parts of the foot that function. But yeah, you know, we all kind of make it work with what we got.
I was just recently watching the Dawn Wall, where the gentleman loses one of his primary fingers and just adapts. You know, this kind of sheer obsession to, I'm not going to let this get in the way, and you know, to then sort of do this incredible feat of, you know, achievement. You know, it's just remarkable. So, you know, it sounds like you got a little bit of that in you as well, in terms of you're not gonna just take this down lying. You're gonna keep trying to, you know, live by your values and do those things that you know, you love.
Although I'm no Tommy Caldwell when it comes to rock climbing. But yeah, try to make it work. Yeah.
So tell us about your story with, obviously, you know, this huge, horrible accident occurs, you know, quite significant misfortune, and then, you know, you go through these surgeries. I'm assuming that's where the relationship with, you know, the opioids begin. Yeah.
So we have this really miraculous surgery that does this incredible thing with really complex medicine. And what's kind of ironic about the whole situation is while these specialty teams do this incredible thing, they had a really simple job by most people's lights, which is to keep my pain under control using medicine that all doctors are pretty comfortable with these days, which is opioid painkillers. And this was definitely an appropriate use of opioids. You know, a lot of problems when it comes to opioids in medicine are about inappropriate use. You know, in the United States, probably not in Australia, but in the United States, for something like 2 decades, our dentists would prescribe opioids after routine tooth extractions. And so, you know, kids would go home with like full bottles of hydrocodone and oxycodone, just for a little bit of tooth pain, which is a terrible use of opioids. And we've now realized that, and we're trying to rectify it. But post-surgical pain, post-traumatic pain, like this was a totally reasonable use of opioids. I was in incredible pain. That at first the foot had been so mangled, and then they continued to do surgery on it. And, surgery involves cutting into you. And so that causes more pain. Eventually I would have this transplant surgery, what they call a free flap, where they take the tissue from my thigh and move it to my foot. And so then I had a surgical site on my thigh. So this involved a lot of painkillers, and all of these surgeons are very comfortable using them, but nobody took responsibility for the long-term pain care for me. And so nobody was thinking, hey, Travis, you're going to be on these meds for weeks or months. You need to be thinking about the formation of dependence, right? If you try to get off them, you're going to face some withdrawal. There's a risk of addiction. Like, nobody was having these conversations with me. And so instead, I got handed off from doctor to doctor, nurse to nurse. They all just kept writing these prescriptions, telling me to stay ahead of the pain, because you don't want to kind of lose the fight to the pain and then struggle to keep up with it, they would say. So every 4 hours, I just take more pills. And the thing that opioids do is they cause tolerance. And so, every several days or week or two, the same dose wouldn't quite give me the same pain relief. And so they'd write for an increasing dose. And the end result of this is they finally finish all these surgeries. They send me home from the last hospital. It's been about 5 weeks since the accident now. I'm on whopping doses of these opioid painkillers, a dose that, if you have never been on opioids before and you took it right now, may kill you. You might actually overdose on it. And I just keep increasing my dose over the next month or so that I'm home from the hospital. And so it's not until 2 months after the accident that my initial trauma surgeon sees me at a follow-up appointment. He sees how many painkillers I'm on, and he says, oh my gosh, you're on way too many pills. We need to get you off of this. And that's what really starts my trouble, because I'm now on these very high doses. And so what needed to happen is I needed to be tapered off of them, because you can't just go cold turkey. You go cold turkey, you go into withdrawal. But what my doctors didn't know is that if you taper too fast, you still go into withdrawal. And if you don't have kind of care and, mitigation of withdrawal symptoms alongside, you can be really sick for a really long time. And so eventually my plastic surgeon, who'd been the last one writing prescriptions for me, he said, okay, taper off all of your meds over the course of 4 weeks. And I tried to do that, and it just cast me into catastrophic withdrawal. I became so incredibly ill. And that's what led me to the TED Talk that you saw. And that's what changed my whole perspective on my research and everything, because it seemed very problematic that my doctors didn't know how to get me off those medications.
It's quite interesting, because on face value, it kind of sounds reasonable, doesn't it? It kind of just says, okay, you're taking some medication for pain. We'll just go out and, wean you off over 4 weeks. What could be the problem?
Yeah, well, exactly. What could be the problem? And, this was a young doctor. He specialized in plastic surgery. Very few of his patients probably ever get to doses like this, are never on for this long. So this was a really complex case that he worked with his mentor on, and he was just unprepared. He would eventually admit this to me, and he'd say, look, I'm sorry, I'm out of my depth. But by the time he admitted that, I'd been in withdrawal for a week and a half, 2 weeks, and I thought I was dying. And if any of your listeners or viewers, if you don't know what withdrawal is like, sometimes we get our images of opioid withdrawal from TV or from the movies, and, somebody goes into heroin withdrawal, and so they get all shaky and sweaty and sick, and they throw up or they have diarrhea, and then they sleep for a couple days, and then thank God they're all better, right? Like, that's how it's depicted in the movies. But it can be really catastrophic. You get all of these symptoms that are like the worst case of the flu you can imagine, times some order of magnitude. And then you get the psychological symptoms, because withdrawal is the opposite of a drug's effects. And so one of the effects of opioids is euphoria. That's why people like opioids, right? And so withdrawal is dysphoric. It causes anxiety and depression. And eventually for people like me, I mean, it drove me to start thinking about suicide because I thought I was so broken that I would never be whole again.
That was a part of your talk that really kind of caught me by, I don't know if I say surprise, but it certainly touched deeper, where you got to a point of despair, a place of complete hopelessness where the solution was very real and compelling. That, I think it was in your fourth week of withdrawal, and maybe you could talk a little bit about that a little bit more in a moment. But in your fourth week of withdrawal, you were broken. You were at your wit's end. You were not sleeping. Everything about you was dysregulated. Whether it's your temperature or your thoughts. The way I was kind of hearing it and trying to appreciate it was, this was something that was all encompassing, and you just couldn't see your way out, despite reaching out to numerous professionals to kind of say, please, help me.
Yeah, no, I think you got the account pretty well. So every week of withdrawal got worse, and that's because the severity of withdrawal symptoms tend to track the percentage of the dose that you reduce. And so that first week, the doc said divide it in 4. And so that first week I reduced a quarter of the daily dose. But then I had dropped it, so I was down to a lesser dose. And so then the next week, I was actually dropping a third, right? And then the third week, I was dropping it by half. And then the last week, you drop everything, right? You go from something to nothing. And so it's actually, I've since learned, I've done all this research.
It's not actually a 25, 25, 25, 25 drop. It goes from 25 to 33 to 50% drop, because you get to that tolerance of, you get to that level of whatever you're at, and the percentage increases. So at the very, very end, you've got a 50% reduction. It's halving someone's dose. It's incredible.
Yeah, that's exactly right. And then at the very, very end, it's everything, right?
Yeah, it's 100%. Yeah. My apologies.
And no, yeah. So every week when the symptoms would get worse, we'd start calling doctors, we'd call nurses, we'd call everyone we'd get a hold of, and none of them would help. And most of the time they wouldn't know what to do. A lot of times they didn't want to talk to me because addiction is very stigmatized. And if you're withdrawing, you look like someone suffering from addiction, right? Which wasn't what I felt like. And we can come back to that. I just felt very sick. But when they see somebody withdrawing and saying I was on all of these opioids and I can't get off them because it hurts, they're thinking, you're an addict. And so that's not something I want to deal with. So we were facing a lot of stigma as we tried to find people to help us. But I didn't want to stop because I was already so sick and I didn't know how long that would last. And so every time the next dose reduction came up, my partner, Sadi, and I would talk and she'd say, do you want to stop doing this? And I'd say, well, look, maybe if I stop, I'm still going to be sick just as long. And then I won't get off. Right. And here's the thing. I became convinced that if I ever went back on the meds to make the symptoms go away, that I would just never come off them again. Right. I was 100% convinced of this. Like, I would never make myself go through this again because it felt like dying. So as it gets more and more severe, by the second week, the depression had come in. I started having these fits of crying, which was very disconcerting because that's not something I do a lot in my normal life. And then, by that fourth week, I've gone completely off the medicine now, and my entire body felt racked. I hadn't slept more than a few minutes to a half hour at a time for weeks. And then that last week, I just stopped sleeping at all because remember, withdrawal is the opposite of the drug's effects, and opioids are sedatives. They sedate your system. And so when you're withdrawing, you've got this kind of jitteriness and these shakes and this kind of hyperactivity. And so every time I tried to lay down to rest, I would kick and my arms would twitch. And so the sleeplessness really compounds everything, because you have this crushing depression, you feel incredibly sick, and you never sleep. So you have it 24 hours a day. And it really does feel like it lasts forever, right? The days go on forever, the minutes, you just watch the clock. And from, 2 a.m. to 3 a.m. takes 5 days, right? So by the end, it sounds crazy to think that, I was sick for 4 weeks and thought of killing myself. But by the end, you really do. You have all of this time to think to yourself and to wrestle with your demons, and all you do is suffer. And because you're depressed, your brain convinces you that you can't be fixed. It's like your own body turns on you and is your worst enemy. And I had this incredibly supportive partner who would come to me every day and say, "You are going to make it. I know it doesn't feel like it, but you will." And I couldn't believe her. Like, I just couldn't. I thought, I'm glad for you that you believe that, because maybe it makes this easier to watch. But I think I'm going to die at the end of this.
And I don't imagine you can believe it, because anyone that's had children knows what it's like to have a little bit of sleep deprivation. Yeah. And children are probably 3% of what you're describing, where, you might get interrupted sleep or get shortened sleep, where you get 2 hours a night, and, but the following night you might get 4 hours, or it might be broken, or you might sleep during the day. But when you're not sleeping, you very, very easily and quickly fall into depression, and hence why we've got, high rates of, postnatal depression. I don't really like that term, because sleep deprivation will do the exact same thing, and it's a little bit simplistic to just label people in that way. But you've got no cognitive power to think your way through. Anyone that hasn't slept for one night, so hasn't slept for 24 hours, starts feeling the effects where, you just start going a little bit crazy, right? You can't think straight, your memory's shot, you're irritable, you can't listen anymore, you're just not encoding. And how the hell can you think your way through this, let alone weeks?
Yeah, you're exactly right. And you get like borderline hallucinogenic, right? Like your brain really, really stops functioning. It's, I tell people when I try to convey how awful this is, and the reason for that, by the way, is because I want people to understand the difficulty that people who are using drugs for any reason, whether it's prescription or illicit, I want compassion built up to understand what it's like to withdraw from these drugs. And when I try to convey it, I say, I had my foot blown apart by a van on my motorcycle, and every minute of withdrawal was the worst minute of my life, right? It made the pain of surgery and the pain of trauma look like Christmas vacation, Yeah.
That's incredible. That's absolutely incredible. It's it shows how the psychological, pain, torture is much, much worse than the physical that, is localized, at least, rather than your whole experience. Did you have visual disturbances? Any sort of? I know that, for example, when I've driven long distances in Australia, you tend to do so because we've got thousands of kilometres sometimes between one city to another. If I've done like a really long drive, 10 plus hours. It's not unusual if I'm tired, and I wouldn't suggest, and I haven't done this very often, but I might see, for example, kangaroos jumping across the road, which clearly aren't there. It's just that, your mind starts playing tricks after a period of time. And, these are things kind of like, you see something, on the side that you need to be cautious of. Did you start having some visual, I don't know if we'll use them disturbances, but, visual things that others could not see?
I don't remember that being a real big part of the actual withdrawal process. I remember having kind of mild hallucinations when I was on the opioids, because something similar is happening to your brain when you're on the drugs. You're on this kind of like somewhat conscious, plane. And so you're heavily sedated. And even when you're awake, you're not encoding very well. And so I tell one of these stories in my book that I basically, it's actually kind of funny. I would see the world as if it were the actual world, but kind of in a gray scale. So I would think I was still awake, but my eyes would kind of slowly shut, and I would see everything in a gray scale. And so I would still be in the hospital, and I would see my hospital room, and I would hear conversations, but they wouldn't track reality at all. And so I started describing this to Sadia, and we thought it was just kind of funny at the time. And then one day I woke up, or I came to, or whatever the right word is, and I'm groggy, and I say to Sadia, "Were you just doing yoga with the nurse?" And she looks at me and just kind of said, "What?" And then I kind of woke up a little bit more, and my brain cleared a little bit more. And I was like, yeah, you probably weren't doing yoga in my hospital room with one of the nurses, huh? But I had totally seen this. I'd seen in the kind of grayscale, the two of them on the side of my hospital room doing yoga. So that was it was a fairly humorous version, but it's actually kind of distressing. Like, once that happened for very long, it kind of weighs on you a little bit that your brain is misfiring in some pretty strange ways.
I imagine that can also be incredibly unsettling, as a human being, to say, I don't know if I can trust my own judgment, my perception, what I'm seeing, what I'm hearing. My reality is warped.
Yeah, definitely. And I should note that this is only when I was on the really high doses.
Sure.
So it would tend to be after major surgeries. So when I go home, I'm on more modest doses of just oral oxycodone or something. That wouldn't be. But in the hospital, I'm on those same oral doses, and I'm getting intravenous, fentanyl or hydromorphone. So I'm getting some really heavy drugs directly into my veins to try to kind of take the edge off the incredibly sharp pain of surgery. And that's when you're on these doses where you're kind of actually flirting with the same mechanism that causes overdose, right? Because your respiratory rate really lowers over the course of those kinds of doses. And so you're hooked up to an oxygen monitor to make sure that you're taking enough breaths to oxygenate your blood. And if the oxygen rate falls too low, the nurses come in and wake you up and put you through breathing exercises. So that actually happened quite a bit. When I was on these really heavy doses, I have to wake up and go through these breathing exercises, because the way that opioids kill people is they cause respiratory sedation to the degree that you just stop breathing.
Yeah, wow, and that's, I suppose, testament to the level of work that was done on your foot, and the incredible pain that you would have been in. That's actually what you are going out and seeing as being the valuable side of pain management. That in those times, irrespective of what's mind you were in, it was a much better space than going out and sitting in the pain of, post-surgery, where I imagine they'd cut through all sorts of flesh and drilled through bone and God knows what else.
You got it. Yep, you got it. Stuck pins in the feet and, sewed things together. It's really astonishing to imagine that some parts of the world don't have access to opioid painkillers, because if you're in genuinely severe pain, it's totally preferable. All the side effects, all the risks, sure, but the pain is unbearable.
And there's that natural progression of, I'm in more pain. Fine, Travis, we understand. Let's give you a little bit more. We don't want you in pain or suffering. This is in your best interest. And that sounds very reasonable and plausible. As a matter of fact, getting through that stage is not really something you're kind of questioning. You're more questioning about where is the support or the protocols or the education or the understanding from the medical space, the fraternity, the establishment, whatever word we put it, or even on our own personal knowledge as human beings, how do we know how to get off? Because as you mentioned before, it's very, very hard in that state to say, my name's Travis, and I work in John Hopkins as a researcher, and I've got all these things in ethics that I'm looking at, and so on and so forth. You're kind of like, hi, I'm Travis. I'm on this dose, and I'm having withdrawals and sweats and so on, and no one kind of knows who you are. There might be some stigma. What do you think that accounts for this kind of lack of guidance and direction that you received? And not pointing the finger at any one, professional, not by any means, but what is it about this space that meant that you fell through the cracks?
Yeah, so exactly right. Not pointing fingers, right? That's the least helpful thing. And I was at 3 world-class hospitals, right? And I had obviously fantastic physicians because they stitched together this mangled foot, right? So it's not the problem of any particular individuals. It's clearly a systems problem. It's that patients like me face certain gaps in care. And so we fall through the cracks, as you say. Okay, so why is that? Here's what happened in America, and it's kind of a cautionary tale for places like Australia, right? We had really, really problematic overprescribing of prescription opioids for about 15, 20 years. And the result of that was a significant and quick increase in addiction and prescription opioid overdose death rates. So that kicked off this kind of drug epidemic that we've seen. Now, our response to that was to get totally freaked out and say, doctors are killing their patients. We need to fix this. And so we've really started to try to kind of slam the door on this tide of prescription opioids that were just flowing freely for years and years and years. When that happened, everybody was looking for a simple solution. And so they were looking towards like, hey, doctors, just stop prescribing so much. But no one thought, you might need to know something in order to do that, right? The hope was, the idea was, these reactions are largely made by politicians and people who aren't doctors. And so the idea was like, it should just be simple. Doctors wrote a bunch of prescriptions that were irresponsible, so stop doing that. Well, what cases like mine show is even when opioids are called for, because surgery, trauma, these are obviously good uses of opioids, there's a whole other problem, which is that when you use opioids, you then have to manage them. You have to educate patients on the risks and benefits. You have to counsel them to help them figure out when the pain just needs to be suffered through and when it should be medicated, right? All of that takes a lot of expertise, a lot of compassion, a lot of time, and we don't have space for that in our healthcare system. It just doesn't work very well. So what we have instead is we have a kind of prescribe and forget culture. I'm happy to sign my name on this prescription for 60 pills. By the way, I'll never see you again, right? So go take these pills and I hope you're better. The result of that is we have patients like me who develop a dependence, where dependence just means like my brain has adapted to this drug, and if you take it away, I'm going to go into withdrawal. That dependence can develop into a full-blown addiction if it's not caught, if it's not mitigated, if there's no one to help you kind of avoid the behavior of going back to the medicine. Or it might not develop into an addiction, but you still have to face this really torturous withdrawal process. So here's the kind of long-winded answer to your question. We have to do more than just focus on that act, right? The act of just like prescribing pills, because our reaction to the overprescribing was to be like, hey, doctors, stop killing your patients with so many pills. But we didn't realize that they still have to use the pills sometimes. And so there have to be other things they can do. When you use the pills, do it responsibly, manage your patients, help them to get off the medication. So that's basically what I've been doing for the last 4 years. So I've been going around and talking to healthcare systems. And as I've, made this my research career, I've started to learn some of the data to help them see what they can do. Like, what does responsible prescribing look like? What best practices could there be? And that gets down into the weeds, and it can be institution specific. What works for one big hospital like Johns Hopkins might not work for every clinician in some rural area in the middle of the country. But everyone has to figure it out, because you can't prescribe and forget. That's not an okay way to do medicine.
And it's also, I heard in the talk that you did, it's also about, as you say, managing your patient through the process of coming off, because watching the pain of you describing what week 1 looked like, what week 2 looked like, what week 3 then looked like. Part of me was compelled to go out and in actual fact want you on it. Kind of say, look, I don't want you sitting in that pain. I see your desperation. I can help. I can, let's take this discomfort. It's hard for me to watch you. I want to take my pain away, to live easier. So what I'll do is I'll ease your pain. It's kind of like, I'm assuming there were probably those times where your partner was like, you sure? You sure you want to do this? And you were very strong-willed in just saying, no, I'm going to do this. I imagine a lot of others haven't, that they say, I can't do that. I can't live like that. I will go back and, quite potentially easily access it again, because, what reasonable doctor is going to say no to their patient who's desperate, and this is kind of like a relationship that needs to be built between patient and doctor, to work on it together in a uniformed way, or an informed way, my apologies. But it's very compelling to say, stop this madness, Travis, just, go back and take some more, and, we'll review it. But, once again, you can fall through the cracks that way too. And then we're having a very different conversation today. You're still using them at that point in a unhelpful way.
Exactly. Yeah. So my prescribing doctor, his advice eventually was, when we started calling him the third and then the fourth and the fifth time, we'd have to, when he wasn't taking it seriously enough, Saudi would tell him, like, you need to understand he's really sick. He's really being tormented. And then once we got that across to him, then he did. He became very uncomfortable and very worried for me. And he eventually would say, look, it sounds to me like you need to go back on the meds and stabilize. And I imagine you're right. Like, that came from a place of empathy. He was thinking, look, there is something I know I can do to make you better, which is to give you another prescription. And then we'll deal with this again later. And what I said to you earlier, right? The only reason I didn't take that offer is because I was 100% sure that if I went back on the pills, I would never come off of them. And the only correction to everything that you said was, it was not that I was strong-willed. It was because I had this really incredible support system. And so, the thing that keeps me awake at night, right? The thing that helps motivate my work is, I am absolutely convinced I would have taken the offer to go back on the medication if I hadn't had my partner every day supporting me, doing whatever she could to try to make my life less miserable. And then another thing we haven't talked about yet, I had a 1.5-year-old at the time. I had a little baby girl. Wow. Who every day I had to look at and think, I'm a useless father right now. Like, she's going through toddlerhood, and I'm sitting on the couch with my shattered leg up on pillows, high as a kite, while also withdrawing, right? I'm still high from the doses that I'm on. And so I'm kind of cognitively useless, and I'm incredibly ill, like, from the withdrawal. That was how I saw myself that entire time. And so, whenever I thought about going back on the meds, I was like, well, if I do that, then I'm just on them forever, and I'm no good to my kid. And if I'm withdrawing forever, like, if this never gets better, then I'm a terrible father figure, just sitting here ill all the time. And that's the kind of darkness that really led to the bottom of the pit for me, that led me to think like, I can't live like this. If I don't get better, my kid would be better off without me. Right. So I had this incredible motivation. Like the only options for me were get better or it kills me. Right. Like I didn't think being sick forever or being on the meds forever was a real option.
There's this very much, forever story that you talk about, that helplessness, hopelessness, and talks about it being never ending. Did you go into a place at any point, and obviously appreciating that, cognitively you weren't, in your best frame of mind, did you ever have a plan or have thoughts about how you might do it? Did your mind go in that space as well?
No. So this is one of the only things that kind of like gave me some peace afterwards, when I was really scared that I ever really started entertaining the thought. Like the train of thought was, I'm so sick that these symptoms might kill me. And if they don't, and I don't get better, I'll have to do it myself. Like that was the train of thought.
Yes.
And the only thing that kind of gave me some peace afterwards, when I was really ashamed of that, like there's a lot of shame around the idea of, suicidality, and that, I would abandon my kid. Right. And so the only thing that like gave me some peace afterwards was that I thought, oh, I wasn't that serious. I didn't have a plan yet. Right. Like I didn't fully go. Of course, all of that is the product of a lot of stigma, right? It's a product of a lot of like mental health stigma about depression, about suicidal thoughts. And so I've gotten more healthy about it in the time since, like as I've gained some distance from my recovery, that I was very ill at the time, and that there's nothing to be ashamed of. But for a while there, that was kind of the only thing that I held on to, was like, well, I didn't have a plan. I wasn't really like all the way there yet. Yeah.
Somehow having a plan, says it's more risky or it's worse or something that's,
Exactly,
it wasn't that bad. It's like, I don't know. It's obviously you're in the wars. You spoke about at one stage, I think, and please correct me if I'm wrong, but lying on the bathroom floor, with your head resting against the tiles, to try and, soothe your fever, and another sort of, moment later being absolutely, feeling chills and trying to warm up. Was that one of the lows that you found just yourself in? It sounds like that was something you did by yourself, that no one was in the home at the time.
Yeah, that was definitely one of the lows. So the way it worked, we lived in a 3-story townhouse at the time, and the bedrooms were on the top floor. The middle floor, the living area, didn't have a bathroom, which was a terrible design for somebody who can't walk and go up and down stairs. And then the downstairs was a kind of walkout basement that also had a bathroom. And so Sadia would sleep up in our bedroom, but especially during the withdrawal process, I just slept so little that I just stayed on the couch on the main floor all night, and I would try to take cat naps at the beginning, and I'd watch TV most of the night, try to distract myself. And so what happened that night, that was in week 4, that was definitely the low point. I woke up thinking I was going to be sick, and I was on the middle floor with no bathroom. And so I kind of scooted over on a knee scooter that I had, where you kind of rest your leg on a seat and scooch along. I scooted over to the stairs, and I have a crutch there, and I crutched down the stairs, which is just incredibly dangerous. Like I would only ever go up or down the stairs with Sadia there, because I had no balance, but I thought I was going to be sick immediately. And I kind of crutched down the stairs as fast as I can. And I somehow make it, and I have a walker down there, and I walk her to the bathroom, and I try to throw up. I try to be sick, but I haven't eaten anything in days. Right. And so nothing happens. And so I'm just like violently ill, but with no results. And it just goes on, and it's torturous. And And when my body like pauses for a few minutes, yeah, I'd collapse on the floor of the bathroom. And if I tried to move again, if I tried to like get to there was a bed out in the basement area. If I tried to get out there, moving would make me nauseous again. And the whole thing would repeat. And so I spent the entire night without sleeping a minute on this bathroom floor, trying to be as still as possible so that I didn't get nauseated again. And yeah, I would be, sweating profusely, trying to cool my head on the tiles. And then I would be freezing, but I'm on a bathroom floor. I've got no blankets or anything. So I remember one point I reach up and grab a bath towel that's there and try to cover myself with a bath towel. Yeah, I still have nightmares about this night. It's the worst night of my life, hands down. And it was actually when Sadia woke up the next morning, and she would have come down in an instant. Most of the nights she would check on me in the middle of the night. She'd wake up if she heard anything, but she's on the upstairs, I'm in the basement. So we're 2 floors separated. And so I would have had to call her if I wanted to. And I was trying to be so proud. I was trying to be like, she needs to sleep. Like, she's raising a kid, going to work, and dealing with a husband who's an absolute wreck. Like, so I was trying not to bother her yet another millionth time in a row. And yeah, when she finally woke up in the morning, and I tell her all about this, we get really scared. I was really scared the whole night. She gets really scared hearing about it. And we actually decided that I would go back on the medication that day. That was in week 4. And so she called the doctor and said, okay, we're going to do this. We're going to go back on the medication. We're scared, but can you at least prescribe us low doses so that, he can take only as much as he has to make the symptoms go away. And then maybe it'll be easier next time. And so she picked up a new prescription that day, stayed home with me. And I was completely ready to go back on the pills that night, but I just happened to fall asleep. Like, I finally got completely exhausted, went to bed for the first time in days and days and days. And I fell asleep before I took any of the pills. And I got a real chunk of sleep. I got like 6 hours of sleep. And when I woke up from that, I wasn't out of the woods. I wasn't better, but it was this break. You know how like when you have the flu, you go to sleep at some point and you wake up and your fever's broken and you still feel crappy, but it's like, oh, I see the light at the end of the tunnel. That's what it was like. I woke up and I felt so much better that I was like, oh, I can finish this. I can finish detoxing, right? But that's how close I was. I had the bottle of pills ready to go back on them, and I just happened to fall asleep that night.
Did you feel like that next morning you made it, if you will? That you got there?
Man, I thought even though I still felt kind of bad by any reasonable standards, I still sore and kind of chilled and a little bit nauseous, right? Compared to where I was, like my mental health had cleared up some. I didn't feel like I was going to be sick constantly. I wasn't constantly sweating. The very first thing I said to Sadia when I woke up, and she was watching me because like I had slept, right? So she just like sat there watching me, just like praying that it was going to be over. And the first thing I said when I woke up and she asked how I was like, I want to eat. I want to eat something. And it was like the happiest I've ever been. So maybe second to like, my kid being born and getting married, but it was up there. Yeah.
It's incredible how all those normal functions start to return. A bit of sleep, your appetite returns. It's almost like you've kind of broken the back of it. You're at least on the upward trend at that point.
That's exactly how I felt. Yeah. It's not that I felt great. It's that I'd broken it and I was coming out, and that was enough. Like knowing that I was coming out, like knowing I wasn't going to die. Like that was
hope returned. Hope returned. How much longer did it take? So that's the end of week 4. Is there another 4 weeks? Is it within a week after? What was your experience?
It's a really good question. So the really acute symptoms faded pretty quickly after that. So that was at about day 29 or 30. It was interesting. Sadia and I went back to the calendar many months later and tried to cobble my notes together because I was trying to write about the experience. And I think it was day 29 or day 30. So I hadn't had any medication in my system for about 8 days that day when I finally slept. And so it looked like the withdrawal symptoms peak acuity was happening over the course of about a week, right? And so the last week we dropped the last dose, and it had started fading pretty dramatically by day 8. That week, things got better really quickly. I ate, I slept every night. So I definitely felt more human more quickly. What's really interesting is I've since learned about something called PAWS, which is post-acute withdrawal syndrome. And it tends to be much more serious in cases of people who have been on opioids for years. We have people in the US who have been on long-term opioid therapy for 10 years, 15 years, 20 years at this point. And so PAWS is a really serious worry for those people because their brain is so accustomed to the presence of prescription opioids. So I didn't have anything like that amount of time. I'd been on it for something like a couple of months. But the thing that's really interesting is I would get flare-ups of the symptoms out of nowhere. And that lasted for 6 months.
Wow.
And it wasn't acute. It wasn't real severe. It tended not to really disrupt my life a ton. But it was scary because I was traumatized by this event, right? It had been so terrible and so terrifying. And so I would lay down every once in a while and my legs would start to shake. I would get the tremors. And it was this very particular feeling, the feeling of being in withdrawal when you get the kind of shakes, the jitters that go along with that. It's a very, very particular feeling. And it would kick in just randomly for months afterwards. And every time it would send my heart into my throat, I'd have this panic that it was coming back, and it never did. It would come and it would pass and I'd be okay. But it was scary. Yeah.
Extremely powerful sort of experiences to try and get through, and a 6-month process, thereafter, where this, I might even describe it as almost like a spontaneous recovery of those symptoms that are extremely frightening, and once again compelling to get away from. The fright of, if this comes back, I might have to do something about this. It's scary.
Yeah. And I've spoken to a lot of patients now. Now I've been publishing on this material for several years, and so after the TED Talk and after my book came out, I get emails from people who have been on opioid therapy or people who have been addicted to heroin or illicit fentanyl. And what's very interesting is you learn pretty quickly that there's a bit of a bell curve in nature when it comes to kind of sensitivity to these drugs. And so I've had a few people reach out and say, I don't understand what your problem is. I was on 8 bags of heroin a day. Withdrawal was no big deal for me. I'd get sick for a few days, whatever. I can survive the flu. And then I've had other people reach out and say, I literally only was on medication for 10 days. And I got so sick afterwards that I was scared it was going to kill me. And then the patients who are really kind of, they kind of speak to the moment that we're at in the US in particular, are these patients who have been on opioids for years and years and years, because they were aggressively prescribed opioids for chronic pain starting in the 1990s. And what some of them tell me is that when their doctors, decide to try to taper them because now we're getting less comfortable with opioids, or their doctor retires, and so they have to find a new doctor who's really scared of these doses they're on. And so their new doctor tries to taper them or cuts them off. Their withdrawal symptoms, some of them have said, I've been in acute withdrawal for 4 months. I've been in acute withdrawal for 8 months. Their stories, because of this incredible dependence, are really scary. Those are the folks who I really worry about right now, because the healthcare system has put them in this position where they have a profound dependence on the medication. And now we're getting less comfortable with it. And so we're saying to them, maybe it's time for you to get off. And they're really, really scared of this withdrawal, which I now completely understand how you could be scared of this withdrawal process, right? So, I think for a lot of people, it won't be as bad as it was for me. And for a lot of people, if it's just done well, so if your doctor has a tapering plan that's sane, where you taper, 5 to 10% every week, 2 weeks or 4 weeks, it'll take a long time, but it won't be that bad. But then some people are even more sensitive than I was, or they've been on it for so long that it's just really hard. And that variability, I think, is crucial for everyone to understand, because doctors have to understand there's no algorithm here. Every patient's different. And so tapering is just a hard skill to learn.
What is the big message that you're hoping to convey to the world, having been through this? What is it that you hope comes from, your experience, your talks, your book? What do you hope changes, in the world of opioid use?
That's a really hard question. I guess something like the following. So people take drugs for reasons, and I took drugs that happened to be prescribed to me by my doctor because I had my foot blown apart, right? But a lot of people all over the world take all sorts of drugs for similar sorts of reasons. And so it turns out that in my life, where I live, doing what I did, the first time I had real cause to take an opioid was a prescription that came from my doctor. But I've now talked to people in different circumstances for whom heroin fills this purpose, right? Heroin is an opioid just like oxycodone, just like hydrocodone, just like morphine. It does the same basic thing to the brain. And there are communities in the world where it's easier and cheaper to get heroin than it is to have access to a doctor and to get prescription opioids. And what I learned about the effectiveness of oxycodone for my pain translates to other people who take morphine or heroin or illicit fentanyl to treat their pain or their psychological pain or their emotional pain. So there's the first thing that I learned. People take drugs for reasons. And I think that when you understand that, it helps you see people who use drugs with compassion, right? Because it's very easy to understand the allure of a drug when you understand how powerful it is, first personally. And then the other end of that, once you start taking drugs for whatever reason, it's incredibly hard to get off them. It's physically hard. It's emotionally hard. It's psychologically hard. And I had all of the benefits that society hands out. I had a supportive family. I have a stable job that didn't abandon me. I'm a professor at a great university. I had access to all of these resources. I had all of these advantages, and it was still that hard for me. And so part of what I want to think about is, before we judge people who find it hard to get off drugs of any kind, prescription or illicit, perhaps we ought to think about how hard it would be if you lacked any of those advantages, right? So something like that, bringing it all together, people take drugs for reasons, and when you take drugs, it's really hard to get off of them. And I hope that message builds compassion and helps us see drug use when it's risky, when it leads to addiction, when it leads people to overdose, and when it eventually starts killing people at a rate that it is in North America right now. That our response isn't to be judgmental, isn't to be stigmatizing. Our response is to be scared for our neighbors and our friends and our loved ones who are going through this because they need help.
That's an incredibly beautiful message. I think that message is a much deeper one than your own story. It's one of trying to understand and be compassionate in the way that we understand human beings' compelling reason for starting to use drugs, because there's very good reason to start. And there's just as a good a reason to continue, because continuing is a very compelling nature to try and avoid the hell that you went through. And if we can be compassionate in both ends rather than, judgmental, we can be in a better world. And particularly, understanding your experience where, as you say, you had a very fortunate path through and it was still hell. I recently spoke with a gentleman, Danny Shannon, who was addicted to heroin for many, many years, I think 13 plus years, and he talks about, his journey and some of the stories that came out of that, the desperation of getting out of withdrawal. Because I was hanging, it's like the street terms and the like. And he talks about getting his hands on heroin, and it was to get that pain away and being so frantic and the mind kind of racing, and clearly, sleep has not been there and all sorts of things. Willing to take unclean needles because the 5 minutes to go up the road is unbearable. It's just too much. And so, that's that desperation, and hence why it's so difficult to get off this dependency, because it's of that genuine nature. So I'm hearing some similar things in your story, and I think that space of compassion is a beautiful message, and I think you've summed it up beautifully.
Thank you for that. I really appreciate it. Yeah.
Travis, tell me a little bit about how people can get in contact with you. Tell me a little bit about your book, where people can find it, because I think this is a message that I'd love for all our listeners and viewers to hear more about, because I'm sure, if it doesn't affect their life, it'll certainly affect a loved one's life, and we all need to be, I think, more compassionate and prepared, to face this ourselves, because I think your story is, unfortunately not an uncommon one.
Yeah. So I'm easy to find and get a hold of. My website is www.travisrieder.com. And I think that it's probably a little bit harder to get my book in Australia, because I don't think HarperCollins Australia has released it yet. It can certainly be ordered from the US on Amazon or on anyone's favorites websites. But I also post links to any of the media essays that I write. So I've written for lots of different outlets, and I have a lot more coming out over the coming months. And so on my website, I kind of keep a running tab of the essays that I've written that can be accessed, no matter where you're from. And so I would love it if the book gets released in Australia eventually, so that it's easy to get there, but it can, be ordered from overseas. And then in the meantime, also, anything that's online. My first piece that was published out of the book, that was an adapted essay, was published in the Wall Street Journal. And so that's accessible online. And then I've had several other essays in the time since then. I had an excerpt on TED.com. Thanks to my TED Talk, they invited an excerpt there. And all of that's available on the website. Yeah. So anyone can poke around, read about me there. You can contact me. I don't hide my email address. So I'm easy to access from the websites. I'm on Twitter, all that good stuff.
Fantastic. And your book is called In Pain?
Yes, the book is called In Pain, A Bioethicist's Personal Struggle with Opioids.
Fantastic. I would encourage everyone to grab a copy. I'm sure that Amazon here in Australia, or other listeners from around the world, they'll be able to find it. So, Travis, it's been an absolute pleasure having you, and I really appreciate you taking the time to talk about your personal journey. I know it's not easy, but I also want to thank you for sharing your story and your message. I think it's really one of hope rather than one of pain and hell, because I think we can really change the way that we work with opioids and those people in that space to do it better and get a beneficial outcome, when in those times of need. So much appreciated for your time, Travis.
Well, I appreciate it. So thanks for having me on. Great conversation.
Thanks. you.